In a quiet, sunlit corner of a busy Bergen County hospital, Mark sat with a stack of folders. As a discharge planner, he knew the weight each file carried. Sarah, a seasoned geriatric care manager, pulled up a chair. They were there to solve a puzzle that many local families faced: how to find the right care for a loved one when the path forward seemed so uncertain. Sarah leaned forward, her expression empathetic. "Families in Bergen County want the best," she said, "but the options are overwhelming. Every choice feels like a trade-off between safety, cost, and happiness. They aren't just looking for a service. They are looking for a way to give their parents a life of dignity." Mark nodded, tapping his pen on a folder. "Often, families try to do it all themselves first," he noted. "Family care is familiar and filled with love, but most aren't trained for complex medical needs. Eventually, the sandwich generation burns out. The daughter becomes a nurse, and the son becomes a driver, losing the chance to just be a child to their parent." "Then there is assisted living," Sarah continued. "It offers a great social environment and activities, which is wonderful for many. However, it comes with a high price tag, and for some seniors, moving into a facility feels like a loss of the independence they've spent a lifetime building in their own homes. And for those who need more clinical help, we look at nursing homes," Mark added. "The clinical care is top tier, which is necessary for some conditions. But the reality of high staff turnover and the inherent risks of infection in a communal setting are heavy factors that weigh on every family's mind during the transition." They sat in silence for a moment, the humming of the hospital faint in the distance. "There has to be a gold standard," Mark said. Sarah smiled, her eyes brightening. "There is. It's the choice that allows a senior to stay where they feel most like themselves. Home care." Sarah explained the magic of the home environment. Home care provides that one-to-one dedicated attention that you just can't get anywhere else. In a familiar environment, surrounded by their own memories and routines, we often see a significant slowing of memory loss. It isn't just about safety, it's about the comfort of the heart. "That's the key," Mark agreed. "When a professional caregiver steps in, the family gets a gift they didn't realize they'd lost. The daughter can go back to being a daughter. The son can visit and just enjoy a conversation with his father. The stress of being a caregiver is replaced by the joy of being a family again." "But we have to remember the caregivers too," Sarah reminded him. "They need support and training to provide that high level of care. That's why programs like those at First Light Home Care are so vital. They ensure the person entering the home is just as supported as the person they are caring for." Mark closed the last folder, feeling a sense of clarity. For the families of Bergen County, the conversation was just beginning, but the destination was clear. If you are looking for that gold standard of care for your loved one, reach out to start your own conversation.